Dr. Choll came here from sunny San Diego, California. We're getting started on a military family. She's also a rancher and works on a farm taking care of horses, so you can tell she's very outdoorsy. She loves horseback riding, hiking, swimming, running, and probably kicking a lot of butt. And I have to do a really good job because I have a very special visiting surgeon, neurosurgeon from Nevada. He owns his city. He's very prominent and he's going to make sure I do a good job. This is what we're treating right here. Here is an MRI of the lumbar spine. This is the sagittal image looking sideways. This is the back. This is the front. These squares are the bones. These cigar-shaped things are the shock-absorbing discs. You can see this disc is a little dark, has a little annular tear. That's probably been there for a while. But she has mostly back pain radiating down the left leg. So if you look down at L5S1, look at this thing. It's like a little rock in your shoe. Look at that. It's obscene. If you look at the baloney-sized cross-sectional area, that's this one right here. This is what the 4-5 level looks like. That's the disc. That's the canal. And that's the back. This is the front. These are the powerful multifidus muscles. So that looks like there's plenty of room. But if you go down to L5S1, look at this yellow line right there moving. And look at that thing right there. Oh, that's so annoying that they put that little mark there right in my way, but you can clearly see what the problem is. She has a disc herniation on the left L5S1. It's pushing and displacing the S1 nerve root, so that causes back pain and pain going down this S1 nerve root distribution. And she's not gotten better with various non-operative treatments. It's been almost a year, so we decided to do surgery, and she elected to do the best surgery that I have in my toolbox, the LES procedure, laser endoscopic spine surgery, through a tiny little cannula and a Band-Aid. And the idea is to avoid injuring the muscle tendon complex of this really powerful muscle called the multifidus. It is the main stabilizer of the lumbar spine. It's huge, and if you are sitting down, you can feel the back muscles fire when you just shift positions. It's like a piece of wood. So instead of detaching the tendon, removing a big window of bone, we're going to just sneak by here like this through a little cannula and use this endoscopic system to get inside the canal and do all the work without destabilizing the spine and minimizing what we call collateral damage. So we're all expecting a great result. I love the surgery, and hopefully she'll do like my other patients and do it spectacularly well. So wish me luck. Okay, I've got the spaghetti noodle dilator right at the working triangle. That's the surgical target site. I stuck this skinny little needle into the middle of the disc. I'm injecting the dye, shot and save. It's a cockapoo disc. See how irregular it is? It should look like a hamburger, 2 buns in a patty, instead of like cloud cover and Hurricane Ian or something. And if we're lucky, we'll see a leak out the back, and it'll outline the disc herniation. Shot and save, but not today. Shot and save. I can see, you see that line right there? Behind the disc space? I bet you that's the outline of the disc herniation. And now when we look in there, we're able to tell very quickly. 3 times. See the crown? Can you see that? How it's, the teeth are unidirectional?
Oh yeah.
So if you go like this, it cuts. This way, caresses. So you'll see, I don't push down and just go ramming in there, and I don't go. It's more like a tight ring on your finger. You're not going to just go kunk or kunk and be like, oh, I got this. It's almost there. Almost past that knuckle. That's what it's like. Shot. Laterally first. That's my best.
30 degrees scope?
Yes, or 25. I want to quickly identify a bony landmark, which is going to be the edge of the facet joint that I just shaved, right? Do a lot. So that's clearly bone right there, right?
Yeah.
So I know exactly where I am. I'm on the lateral border of the canal. That is probably the neural foramen right there. And that has to be the disc herniation. 12 o'clock is lateral.
12 o'clock is
look, I'm looking upside, look right here. Upside down and backwards. Right? I'm going like this. Toward me. Watch. See that? That's got to be the disc herniation based on geometry and where the disc herniation was on MRI. So now all I need to do is look medial and confirm I know where the dural tube is, right? It's right there. Look at how scary that is.
That being the S1 nerve.
Probably. That's probably the traversing nerve right there.
Right.
So now I want to use this thing to basically dissect and push the traversing nerve root medially, right? Like you would in a flip. Kendra's got the hardest job in the entire room right now. Kendra is like an awesome videographer, by the way. So thank you, Kendra. Oh, I was so excited. It's just like my teenage kids won't come out without a fight. Doesn't the blue seem so helpful all of a sudden? Because if you didn't have this blue, it's like, how do you know that's not an edge of a nerve? It's like, I don't. Because everything is a nerve until proven otherwise. This sucker is not wanting to come out very easily. So I'm leaning more and more medially like this, pushing the nerve, the traversing nerve more and more medially, like a nerve retractor would. I am right above the disc herniation. This is definitely it. I just have to be patient now and get all the pieces out, because this is a punk teenage disc herniation. It's going to make me take out all the pieces one at a time, rather than one massive big piece, which can be so gratifying sometimes. That is clearly the dural tube. Push down.
Yeah.
Like that.
Did you have to what?
Aiming laser, like you have on your pen. So you know exactly where it's going to hit before you even turn it on. You see that?
But you can't see the laser.
No.
Okay, I got it.
Can't see your eyes, right?
Yeah, and I don't blink apparently.
So you try to go past or deep to the annulus, ideally, with So this
I just go after whatever the pathology is, yep. But almost all the pathology, you have to reach inside the nucleus and make sure there's no loose pieces. But I mostly do a fragmentectomy.
Okay. But
Like
in
Tony-
general, unless you're doing a T-lift.
Yeah, you're just doing a
You stay posterior to the annulus with your scope.
Yep, exactly, exactly.
No reason to go inside.
Unless you're looking for something. And sometimes you do. You'll see me go in a little bit deeper, especially with the instrument. Like that's not normal right
If
there.
there's an epidural vein, do you prefer to use the RF?
Totally. This does not work very well on epidural veins. Where the disc herniation came out of, this white stuff is the annulus. It should be a big wall of white right here. I wouldn't be surprised if something comes flying out of here in a second.
So who makes the laser?
Trimedyne. Another regular tube, Terry? Oh, that's a piece.
Right.
That's a legit piece. It is stubborn.
They're all stubborn. Yeah.
How rude after all we've done for you. Oh, look at that piece. Oh, look at this. Oh, it's going to be a boy.
Nice.
Oh, look at that. Let's name him Joe.
Woohoo!
Oh, it's so... You know that game when you're trying to... The claw game? And you're trying to... Claw machine. You're trying to get like a toy for your child. And it seems so easy. You just take the claw and hover it over something and grab it. But when you try to grab it, it doesn't work. That's what this is like. Custom instrument number 2, the snaggle tooth. How cute is that? See, probably a really good booger picker too. But we haven't used it for that yet. Okay, I like that. I don't feel anything horribly loose right there. call this the Mikey fragment, the sneaky last fragment that right when I think I'm done, I go, okay, I'm gonna just check one more time. Curly Q2 turn next. I'm all done. Look how aggravated and irritated the exiting nerve root looks like, but it's intact. This is where the disc herniation was, right there. And behind me, I'm going to save that for last. The exiting nerve root is up here. It's not an exiting nerve root problem, so I don't even like looking at it, but if I get a little glimpse of it, I'll be okay with it. I still get the chills when I see the dural tube. You know that? Whoa. So now I'm going to look upside down and backwards. Other than being upside down and backwards, I like this view better because the instrument is on the correct side. Okay, surgery's all done. I can't tell if you can see this adorable little incision right there that I'm going to cover with a Band-Aid. Almost my favorite part of the case, maybe because I'm done and I get to leave now. Not really, but I still, after as many cases that I've done, get a total kick out of that. So the surgery went perfectly. We're all expecting you to get a great result, and we're all praying for a speedy recovery, right guys? Yeah! Woo!